Today's video diary from the World Health Summit 2010 is brought to you by the Faculty of Medicine, Nursing and Health Sciences at Monash University.
Hello and welcome from day 3 at the World Health Summit here at the Charité in Berlin. And I've got a very special guest with us for today's video diary from Berlin. Dr. Master Ardley is the Executive Director of the World Health Summit, and he is the man who essentially makes the summit happen every year. Welcome, Master.
Thanks.
So, Master, we've come here from around the world, and there's some 1,200 delegates, I understand, this year?
Correct, yes.
So, I guess the first question I've got for you is, why are we here? What is the need for a World Health Summit?
That's a good question, Clint. We have been hearing this question, particularly in the last year when we started off, quite a few times, and I think we have this summit now shows the answer. We need such a forum. We need a forum where academia, industry, health organizations, governments unite around the strategically important questions of health research and health care. And what is particularly important is that we from academia are spearheading this movement, and it is a movement in fact, and spearhead this movement to find and identify questions to the many problems and challenges that we are facing in the next years with different diseases coming up in our changing world, and the changing circumstances that we're living in.
Mm-hmm. Now, as you know, Monash has been a very enthusiastic supporter of the summit, and there's a sizable delegation here this year, and a very happy delegation, I might add. How's the summit been going from you, from an organisational perspective?
Absolutely excellent up to now, and now it's day 2.5, and I must say we are having extremely inspiring discussions in the different sessions, and discussions that show that this the concept is the concept works, that people do get involved, and that people do get into contact on this cross-sectoral basis. We are, for example, in the session on IT in healthcare, we've had a lot of contributions from different points of views, from providers' points of views, from payers' points of views, from industry points of view, and that brings us a step ahead. We need to find to discuss the questions how our roles are in today and in tomorrow's world. What have we out of academia on our agenda in order to identify the gaps in for an efficient healthcare, for example. Where do we need IT to step in? Not only in hospital care, but also in large scale research networks, and this goes up to the shaping of health systems. We're having roundtable discussions of different Eastern European health ministers tomorrow, who are all in charge of health systems that are in tremendous reconstruction in post-Soviet countries, and IT is an extremely important tool for them to get their health systems in shape. So these kinds of discussions, led by academia, with the independence that we claim, are probably important and hopefully bring a significant result.
Now, in a forum earlier this week, there seemed to be a little bit of veiled criticism, I think, of what had the summit achieved from last year, and I think Detlev Garnton was particularly deft in pointing out that these are very, very long-term goals, and the summit is addressing issues on a very strategic basis, and it will take a number of years for some of these outcomes to occur in a very changing environment anyway. So can I ask you, Mazda, what's your vision for perhaps 10 years from now, when we're at the 2020 World Health Summit? What do you think that will be like?
Well, I would hope that the World Health Summit moves towards being the central forum to discuss health on the cross-sectoral basis that I mentioned earlier.
Mm-hmm.
I would hope that we are the forum that produces recommendations, that produces key messages that are heard by our government leaders,
Mm-hmm.
by our own academic environment, and put into action. And I think we can even within this short period that we are having since the last and first World Health Summit already see small fruits of this new movement.
Mm-hmm.
We are seeing a reflection in different governmental institutions from what is being said here. We see that the M8 alliance is well known in our governments, and we hope that that this goes on in this way, and I'm pretty optimistic.
Mm-hmm. And there's a number of governments represented at this forum. We've had the South African Health Minister, people from Rwanda. Are there any other nations here, apart from the German government, of course, and the French?
Of course, the M8 countries play an important role. And apart from that, we have had a significant focus on the Global South at this year's conference. This is why we have several ministers of health from African countries. Right now, while we are speaking here, the Vice President of Uganda is giving a talk upstairs, and we've had the regional WHO director for Africa presenting here. So the African continent is very much in focus. We have Eastern European countries represented by their health ministers. The health minister of Serbia is making an important talk tomorrow. As you know, one of the European countries which is not yet member of the European Union. Armenia is presented, Kazakhstan is presented, Georgia is presented on the levels of their health ministers, and that's important for us to find bridges towards the regions that are not in the core M8 group, but which are very much on our focus. And so this is why I'm particularly happy that a lot of countries from the developing and emerging world are present here at the summit.
Now, on a lighter note, tonight is the summit dinner, which is a fabulous occasion, and anyone who has ever been to the World Health Summit dinner, it's an absolutely unforgettable occasion. Who have you got performing for us tonight? We had Max Raab last year. How are you going to beat that, Mazda?
Well, it's a surprise, but if you don't tell your colleagues here, I will tell you. We have a wonderful singer who is just performing in one of Berlin's most famous stages, Cabaret, the musical that plays in Berlin and shows Berlin in the years of the Roaring '20s and.
Don't keep us in suspense, Mazda. Who have you got?
Her name is Sophie Berner, and a very talented and famous German artist.
She certainly is.
And so we're looking very forward to that.
as I am, and I think it's going to be a fabulous occasion. Dr. Mazda Ardley, thank you for being our special guest here on our video diary for day 3. Apart from that, that winds up day 3 here in Berlin. As always, you can keep up with the summit on the summit website, which is worldhealthsummit.org. You can also follow us on the Monash University Faculty of Medicine, Nursing and Health Sciences website, which is med.monash.edu. And 24 hours a day you can have dialogue with us and stay in touch via Twitter, and that's Monash_FMNHS. Until tomorrow, day 4, the final day of the World Health Summit, that's it from Berlin. Bye for now.